Welcome to another conversation on religion and mental illness. I'm Dr. Nancy Keogh, a clinical psychologist and author of the book Wrestling with Our Inner Angels, Faith, Mental Illness, and the Journey to Wholeness. I'm here today to speak with Dr. Silvia Halperin, the training director of the Latino Mental Health Clinic of the Cambridge Health Alliance, affiliated with Harvard Medical School. Dr. Halperin, thank you so much for joining us today.
Thank you for inviting me.
In over 20 years, you have worked in 2 different countries in South America and in the United States in psychotherapy. What has been your experience in working with people around the issue of religion and mental illness?
Well, instead of assuming that there are universal ways in which all patients' faith and religious practices affect the cognitive and emotional processes and behaviors, I like to focus on the diverse and dynamic meanings of God as they appear and are addressed in patient psychotherapy process.
Great.
And I will do it to a brief clinical vignette of a patient. A middle-aged patient has been a victim of emotional and physical abuse in the formative years of his personality. Usually, he brings a positive, protective, benign image of God. He tells me, "I continue struggling, doctor. I hope God will not abandon me." On other occasions, the patient presents a persecutory image of God, an image of a relationship between an omnipotent, omniscient, punitive God and a sinful, despicable person, the patient. And these images can appear consciously in the patient's therapy narrative or unconsciously as a constitutive part of dynamic constellations that emerge in impairing symptoms and overwhelming suffering. In the first case, I don't address the meaning of God in therapy because the patient's positive image of God fuels the hope and motivation necessary for therapeutic change. In the second case, I have to address the persecutory image of God because the punitive image of God, as well as the image of the sinful, despicable patient, interfere with the freedom of thinking and feeling that leads to therapeutic change.
So you really allow and respect and hold the part of the person, the part of his representation of God that fuels his hope and resilience, while really examining for his sake the persecutory image that he holds.
Exactly. I try to include the different meanings of God of the patient, and I make the decision regarding which ones I have to address.
So in our brief time that we have today, because we could spend a lot more time on this conversation, what one message would you like to leave our hearers with?
The main message would be that the meanings of God that appear in patient psychotherapy processes are diverse and dynamic, conscious and unconscious, and some of them fuel the therapeutic change, and some others interfere with therapeutic change, and these ones are the ones we have to address in therapy process.
Well, I'd say your patients are very lucky to have someone who can hold both sides of that picture. Thank you so much for joining us today.
Thank you for having me.